So thank you so much, Eagle Tie, for inviting me to lecture and share my experience on this miraculous instrument, E.S.P, and I will talk about the scleral lens fitting and how easy it is when using E.S.P. So there are two methods for fitting scleral lenses, with and without technology. When fitting with scleral lens profilers, it allows you to reduce chair time, the number of lenses applied on the eye, and the number of lenses reordered to get the final lenses. Additionally, you will also provide highly customizable lenses. So along with all these considerations, patients are very much appreciative of your practice and of your fitting process. They perceive in you an expert in scleral lens fitting, and they would trust you better. While if you apply different diagnostic lenses on the eye and order several lenses, patients may get anxious and may perceive a non-experienced professional in you. So that technology allows you to get to the next level and to get more expertise in scleral lens fitting, especially to customize your lenses. So how to fit scleral lenses without any scleral topography? How to understand the ocular sagittal height to select the first diagnostic lens. So you may look at the eye profile and guess it, or using a corneal topographer. Some corneal topographers provide the corneal sagittal height at 10 millimeters, but then you need to use a formula or a table to calculate the lens sagittal height at a specific chord. So you need to have some more time to calculate these values while the patient is waiting for you to select the first lens to apply on the eye. So once estimated the lens sagittal height, which diagnostic lens to select? Spherical, toric, which design would be the best for that eye that you would like to fit? And once the lens is fitted, can you tell how much you need to steepen that area lifting off? So here in these pictures, we are seeing different patterns of lens lifting off. In the first photo, we are seeing a mild lifting off, the second one moderate, and in the third one excessive. But of how much you need to steepen that area? Some may think an experienced doctor may estimate the steepening accurately. Well, very interesting to find that this may not be the case. This study is very interesting. This study compared the accuracy of observers' ability to estimate scleral lens contact central clearance with microscopy and comparing it with measurement, objective measurement, which are slit lamp imaging and OCT. Well, the results showed that all groups overestimated central corneal clearance with a biomicroscope compared to objective measurements. And the very interesting finding in this study is that participants with the most prior experience, or the practitioners with most prior experience with scleral lenses, displayed the greatest difference in estimating central clearance. This is suggestive of a bias in their observation from increasing experience with prior scleral lens fitting, while the novice group is more dependent on the given lens thickness and cornea thickness as reference values. So experience does not mean that your estimation of lens fitting is more accurate. So how to select the lens diagnostic lens design? We saw that you, without any scleral topographer, you simply know to guess the lens and to apply it on the eye and hope that the lens is okay. Otherwise, you need to remove it and apply another one. Also, evidence shows that about 66% of eyes have scleral shape that are different from commonly designed spherical or toric haptic design. So this is the main reason for customizing scleral lenses. As to customize scleral lenses, you need to get a good capture of the ocular surface shape. However, if you use the diagnostic set, you may need to select first a toric lens along with these findings, because toric sclera are more common than spherical. And if you need to well fit most of the eyes of your patient, you need to fit customized lenses using technology, because 66% of eyes have scleral shape that are different than spherical or toric. Another reason to use advanced technology, because patients ask for them. Here are some messages I received from patients from around the world who want scleral lenses, but they don't want simply scleral lenses. They want them made with advanced technology. And they ask me, do you make scleral lenses with advanced technology? What technology do you have to fit your lenses? And they are available to travel to find the technology they are asking for. And here is an email that I received recently, last week, of a patient not asking if I fit scleral lenses, but he is looking for customized scleral lenses, non-standard one, and he is willing to travel to find the technology for his girlfriend, and he is from Germany. A further reason to customize scleral lenses is to increase comfort during lens wear. A study have shown that switching from spherical to toric scleral lenses, patients' overall satisfaction, comfort, and wearing time increased. So what I used to do to customize my scleral lenses, because I always customize my scleral lenses that I fit to the patients, is to capture the eye surface with an OCT and then use a software for lens design. But I have to make several calculations. So I made this Excel sheet to make the calculation more easy. However, even with this calculation automated, it was a huge time consuming and very stressful for each lens I had to design. So now I have different technology, and the first step in customizing scleral lenses is to make accurate digital scans of the eye. So there are different technology available. Scleral lens topographers provide several parameters important for first lens diagnostic selection, as we already said, and also allows you to send that to different labs as scleral topography, so they can customize the lens in empirical fitting. The E.S.P uses software to determine the best lens fit of different scleral lens designs commercially available. Its use with diagnostic lens is crucial, again, to save time and number of lenses applied on the eye. And also with the profilometry, these data may be used from different labs to make lenses with free-form design, providing you highly customized scleral lenses. So let's see how important is scleral topography. So here is the topography of the cornea and the sclera. In this case, the software provides several important informations for lens design. Firstly, it indicates the central cone and the ocular sagittal height at a specific chord, helpful for first lens selection. It tells us also that the sclera shows a with the rule toricity. So here you have to keep in mind that the colors with the elevation maps are different from the tangential map and axial map that we see with corneal lenses. With the elevation map, the blue area indicates the steepest area with less elevation, while the red area is the flattest one with the highest elevation. So keep this in mind, because the interpretation of the ocular topography may be different. And so here we are seeing with the rule toricity. And it's not only indicating that the sclera is toric, but it indicates how much is the toricity in this case. So in this case, we have 370 microns of toricity. And this means that we need a toric periphery for our scleral lens. And in this case, it indicates also the exact location, the height, and the width of the pinguecula, which are very, very important to send to the lab to include a precise microvolt in lens periphery. And it's very important because the lab will take in consideration all this data to stabilize the lens, so the microvolt will be at the exact location with the exact dimension in the pinguiculum. This other topography shows a highly irregular cornea and an asymmetric sclera. So here again, we have a significant toricity of 840 microns. And this is very important for lens design. You need to understand how much difference between the two main meridians and how to make the toricity in the lens periphery. Additionally, an algorithm provides insight into scleral profile, distinguishing between 4 core scleral profiles, very helpful to immediately understand the better design for each eye, instead of ordering various lenses to get to the final lens design. And we will see the importance of this algorithm later when I will expose a case report. So for this case, the algorithm recognizes a quad profile, which is better fit with quadrant-specific designs. This is an irregular sclera, and indeed the algorithm indicates the need of an irregular, a customized lens for this irregular profile. And this pattern is very interesting because the algorithm recognizes a quad profile around the limbus, but this profile becomes irregular towards periphery. So in this case, you may think seeing the topography that the quadrant specific design may be helpful for maybe good for this eye, while a customized lens is more appropriate for this scleral shape. So making a scan of the eye allows also to predict the lens fitting on the eye. So we know that when fitting a spherical lens on a significant toric sclera, the lens will touch the flat meridian and lifts in the steepest meridian. So when we see this with the rule pattern, again, the red area is the flattest one and the blue one is the steepest one. And this scleral toricity is with the rule toricity because the steepest meridian is in the vertical one and the flattest meridian is the horizontal one. So when we see this type of scleral toricity, we should expect blanching in the horizontal meridian because the lens touches the flattest meridian, and we will see the lens lifting off in the vertical meridian. And when fitting a scleral lens, that's exactly what we will see. The lens touching this area, this meridian, and lifting off in the vertical meridian. So just by seeing a corner scleral topography, you will understand the pattern of the lens when you will fit it on the eye. Okay, so let's see some cases. This is a 17 years young female with high refractive astigmatism who tried soft contact lenses but was not happy with her vision. Here the option could be ortho-K lenses or scleral lenses. I illustrated her both modalities and she decided for scleral lenses. So here from her corneal topography, you can see the high corneal astigmatism, and comparing it to the refractive astigmatism, we expect a residual astigmatism to correct with the anterior surface of the scleral lens. So this is her scleral topography showing a significant scleral toricity, about 750 microns. So which is important to consider when fitting the lens and include scleral toricity. We will see if only a toric lens is appropriate for this case, or quadrant specific design, or maybe customized lens. So let's get step by step. So here we have all the information regarding her sclera, that the average of the sagittal height and the minimum sagittal height and the maximum sagittal height, and here we have the difference between the two of them. And here are also these coincides with the minimal sagittal height and the maximum sagittal height with the same axis. So considering this, again, is very important for lens periphery, lens design in the periphery, and also we can see the average of scleral radius, not only the corneal radius. So for those who are have reasoning with radius, here you can see that in the flattest meridian, because this line is indicating the flattest meridian, we have the radius of 14.424. And if I change the meridian, you can see how the radius change, and it's about 12 millimeters. These values are important for lens periphery design. If you design your lenses by yourself and you use curves in that periphery, so here you already know that to have a well aligned scleral lens, the curves of the scleral zone in the vertical meridian needs to be about 12 millimeters, and that of the horizontal meridian of 15.50 millimeter. And to better understand the changing of the scleral shape, you can rotate this line and see how the sclera has different elevation in the different quadrants, and how these changes are significant from one quadrant to another. So the software provides you several options for the best lens fit of different scleral lens designs commercially available. But the choice is yours. What design to choose in this case, toric or quadrant-specific design, or customized lenses? Apparently, toric would be okay, but for a further confirmation, I use this algorithm that indeed suggests me a toric design for this eye. So I'm certain that a toric design will be okay. So I can go here and select a B elevation if I work with partial lump. So with all these informations provided by the software, you apply the diagnostic lens, knowing the exact sagittal height and the design of the lens in periphery. Generally, you select only one diagnostic lens, not several one, because the software provides you exact information, important information for the lens selection. And then you apply it on the eye, you assess the fitting and make changes where necessary. When you have to steepen or to flatten the lens periphery, you will know exactly the amount of the change and order the lens with the exact lens parameters in lens periphery. So here we are seeing the fitting alignment, which is appropriate, which is very good in the periphery, and a uniform fold, because if the lens is well centered, so the lens is well aligned, the clearance, the vault over all the cornea will be uniform, and you will resolve with the first lens ordered many issues of lens concentration, accumulation of fluid reservoir in the limbal area, inferior limbal area, prolapse, and many other problems that are due to a non-appropriate lens alignment on the conjunctiva. So here we have a second case of a patient with a null graft. She has a penetrating keratoplasty with a high corneal astigmatism and poor vision. This patient is desperate. She wants her vision back. She is so tired of her vision for 26 years. So it's very old graft in this case. Here we can see her topography. So she has a highly irregular cornea, of course, but also an irregular sclera with significant symmetry and toricity of 310 microns. So here again, by rotating the line, you will see the difference between the scleral shape between the quadrants, but also you are seeing here the difference in curvature in the scleral zone. So you can see that in the vertical meridian how the lens now in the horizontal meridian, how the radius is getting flatter, and when it's get to the vertical meridian, which is steepest, the periphery is steepest. So we have a difference. The horizontal meridian, we have a 17.30 millimeters of scleral radius, while in the vertical meridian is 13.5 millimeters, which is important as difference. So the information with this, that the E.S.P provides allows you to get the final lens with the proper alignment faster. If you prefer to rely to the labs, you only need to send the topography for empirical fitting, and they will design a highly customized lens. So here we are seeing a customized lens, properly aligned in the different areas of the sclera. And the patient's happy receiving the lenses very fast. And in this case, the first lens ordered was the final one. So it's crucial to well-fit scleral lenses because they represent a life-changing for several patients, and problems for non-optimally fitted scleral lenses may represent severe problems. Will get the process, the fitting process, longer and more complicated. Also, some practitioners still are intimidated by the fitting process. So technology may definitely help in this, providing different inputs and information for lens selection and lens also design. What may also be helpful is to deepen the knowledge of scleral lens fitting. Today we have several resources on scleral lenses covering various aspects, from the guide in the fitting process to manage issue and complications. And also now a new project for scleral lens fitting may interest European practitioners and those in the Middle East, the European School of Scleral Lenses, which consists of workshops in 20 different countries in Europe and the Middle East. There will be 2 workshops, few months apart in each country. The first will discuss basic, and the second one will discuss the more advanced fitting. And the workshops include a program of 2 days, where in the morning there will be theory, and the afternoon only practical sessions. And in the practical sessions, we will be using all the technology that are available during the workshop. So we will be able to touch this instrument in live. Thank you very much for the invite and for participating in this webinar. Thank you.